I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We got started with a roll call.
Councilman Baldry?
Here.
Councilman Hoyt?
Here.
Councilwoman Shane?
Here.
Councilman Woodruski?
Here.
Supervisor Leonard?
Here. Okay. The review and approval of minutes from the town board meeting of March 14th, 2022. Does anyone have any comments or questions or concerns about those? All right. I'd like to make a motion to approve the minutes of the town board meeting of March 14th, 2022. May I have a second?
And I will second.
Okay.
Councilman Baldry?
Yes.
Councilwoman Shane?
Yes.
Councilman Hoyt?
Yes.
Councilman Woodruski?
Yes.
Supervisor Leonard?
Yes. We have reports and remittances from department heads and town committees. Before we get started on this, I just wanted to mention to the department heads that people are loving that we're taping the meetings and they're able to see them and access them online. But they were wondering some people were wondering if department heads would like to give their reports from up here so they're on camera. They can be seen, they can be identified, name with a face, sort of thing. So I'm not mandating that anyone does that, but if you'd like to do that, you're certainly welcome. There's a camera. All right, starting with the supervisor reports. Everyone has their reports from March. Okay.
I just want to say on that we received $130,000 from sales tax. So that's pretty big, starting the year off. So that's awesome.
It was a pleasure to deposit that check.
Yeah.
Okay, town clerk's report.
Town clerk fees brought in $390. Trash brought in $2,764 for the month. Planning board was $150 for the month. Building permits was $3,324.75. Then bottle returns for the youth brought in $92.20. Total revenue for the month was $6,750.95. After paying Encon and Agri Markets, the check that went to the supervisor was $6,715.33. But there was a $40 adjustment from an overpayment from last month. So the actual check that went to the supervisor was $6,675.33.
Okay. I'd like to make a motion to accept the town clerk's report. I have a second. Seconded by Councilman White.
Councilman Baldry?
Yes.
Councilwoman Shane?
Yes.
Councilman Hoyt?
Yes.
Councilman Woodruski?
Yes.
Supervisor Leonard?
Yes. Highway superintendent.
We've been out cutting brush and trying to fill the worst of the potholes and stuff. Still a little bit wet to get the graders out. We tried. We've been out raking the roads to get the worst of it off, but hopefully it gets dry here pretty quick. And the graders are all set, full of fuel and grease. We're just ready. Just waiting for the roads to harden up just a little bit more. We can get out, smoothing everything out. But until then, we're going to be out there just patching the worst of the potholes and continue cutting brush until we can get out and start grading the roads. But other than that, all's pretty well.
Okay. Thank you, Jared. All right, for the assessor's report for March, processed sales and escrows from the county, reviewed properties in the field, met with taxpayers, held office hours, went over new construction permits, reviewed exemption renewals and new applications, and attended 2 classes for continuing education, valuation of difficult homes and valuation of manufactured homes. That's Craig Surprise's report for March. Buildings and code enforcement.
We have 7 new permits out year to date, about 25 still existing. Just a reminder on the burn ban, we had some reports of fires. You cannot have a big open fire until May 14th. There's a ban on. Also going around unregistered vehicles, it's that time of year. 1 unregistered vehicle per household, and that's it.
Okay, thanks, Tom. The rescue squad.
We had a total of 11 calls
Mileage was 265. Total hours volunteered 14.5. We had no Alpha, no Bravo, 3 Charlie, 6 Delta, no Echoes, 2 fire calls. We had 2 calls that were missed, 1 call canceled. We used ALS 3 times, Bennington 3, and Mohawk 1. We went to SVMC 1 time, St. Peter's 1 time, and Samaritan 4 times. There were 6 calls in the daytime and 5 calls were at night. 6 weekday calls, 4 weeknight calls, no weekend day calls, and we had 1 weekend night call.
Okay. Sharon, over the weekend, I had asked Andrea, and I don't know your rank, I'm sorry. First Lieutenant Chittenden, for a roster for the rescue squad. Reason being, we insure the we own the ambulance and insure the ambulance, so we have to have the drivers listed. So anyone who is a rescue squad member has the potential to step behind the wheel of the rig. So we need to have an updated roster for insurance purposes. And then we also need the bylaws also for insurance purposes. Okay? Thank you. Dog control officer, thanks. Is Kayla here? No, okay, I think she's running a little late tonight, so we're good. Hey, youth program director.
We did the Easter egg hunt last weekend. We had to do it indoors due to the weather, but it turned out well. We had about 20 kids come out for that. Up at your desk, I put the copy of this year's drop-in summer camp up there. It's just the copy of our letter that's going to go out to the parents, telling them when it is and everything like that, and this year's information sheet, which is a lot more basic than last year because of it being a drop-in program. And I'm working out the schedule as well. We have some field trips planned to use up some of the bottle money, and waiting to hear back on the bus garages. They are not sure they're doing summer runs yet this year. And then every Wednesday we'll be at the park, pick up and drop off at the park this year, so that way the kids can do some swimming and stuff, more like a free swim. We have our regular programs, visitors coming in, and all that.
How about counselors?
What?
Counselors.
We plan on hiring 4 counselors and 1 lead counselor, and I hope to do the interviews in June this year. That way it gives the kids time to, plan out their summer and stuff like that.
Do you have any CITs?
I didn't put the applications out yet, so I'm not sure yet.
Thank you.
Okay, thank you, Noah. The library, Grafton Community Library.
Okay, so for statistics for March, 678 regular books checked out, 227 e-books checked out. Patron visits, 234 adults, 34 children, 6 teens. Programs, we are still doing the Zumba, and the participants asked to have it extended, so we're extending that to 15 weeks, so 5 more weeks. Legos after school is going strong. We started it on March 8th. Last week we had 18 kids, and the week before that we had 15. We started story time up, but have not had any participants. I've contracted with the Balloon Gal to do the town festival, so she'll be doing 2 hours of walking around the park and making little balloon animals and stuff with the kids. We're replacing the story walk up at the state park, so there'll be a new story walk, koalas and the eucalyptus trees. We purchased a pass for the U.S. Slater, which is 2 adults, 2 children, and we also have 2 passes for the state park, and we have a Clark pass. And Run for Roses, we're working on our sponsorship. That's scheduled for 14th of August, and the letters have gone out to our sponsors.
When did you say the town festival was scheduled?
The 17th of July. I think it's 17th, hang on one second. 16th, I'm sorry, it's a Saturday the 16th.
Okay. Thanks, Leanna, thanks. I backtrack to Noel.
Yeah.
Is the summer drop-in program open to kids from other towns?
It is. I contacted Petersburg. They were not sure that they were paying for their kids yet this year. More than likely, she said. They
Right.
would be, it just has not gone through the meeting yet.
Okay.
Yep,
Okay.
but open to all towns.
Okay, good deal. Thank you. All right, State Park. Hi, Tamara.
Hello. So I'm very happy to announce that we have a couple new educators, and this is why I have 4 different flyers of things going on over the next month. So coming up next Thursday during spring break, we have 2 events. We have Trout Discovery Day. So it's from 11 a.m. to 1:30 p.m. Good for all ages, learning stuff about trout. Going to be crafts and things that the kids can take home with them as well. And then the next evening, Friday, April 22nd, on Earth Day, is our Earth Day Festival. So we're going to have tables where people can come, family friendly, and learn different things about the environment and monarch butterflies and pollinators and fossils. And following that at 8 p.m. there will be a drive-in movie in the parking lot. So the movie is kind of up in the air right now, but it'll be some nature-based film to go along with the Earth Day theme. May 1st, we have volunteer spring social. So if you want to learn about what you can volunteer at the park, there'll be a couple people who are long-term volunteers who will be tabling and talking about what they do. So this one gives you just a couple ideas of what you could do at the park to volunteer. And then our annual I Love My Park Day is the first Saturday of May from 8:30 till noon. It's always a good family-friendly, get lots of people. That one is registration online versus the rest of these you do not have to register for. Okay.
Great, thank you. Okay, the Recreation Committee. No, okay. Senior Citizen Representative. They all right? I know they're all the same people. Yeah. Merrymakers? Okay.
They're all the same.
They're all the same, okay.
They do have that survey they're doing,
Yes,
the
they do.
Merrymakers.
Till the end of the month.
With the Merrymakers or senior
Or
center?
the
That's
senior
the
center.
seniors, the county actually.
Senior center, yeah.
Yes.
Okay, under communications received, we have received the final draft of the audit of the town financial records from FAS Accounting Services. And a little later in the meeting during resolutions, we will be voting to accept the audit. And then thereafter, once it becomes official, we will have copies available for everyone. And then just overnight, we received an email from a resident asking about Earth Day cleanup possibilities. Shredding was one issue. If we were going to do a town-wide shredding event, maybe get a shredder parked out here and let people come shred documents. Vicki actually has a little bit of information about the cost effectiveness of that, which it isn't.
The court contacted the company to pick up, to have the dumpsters brought here. And the lady said that you don't even want to know what we're going to charge you to bring them to Grafton. She goes, you would be better off to stick them in your own vehicle and drive them up here, and then we can shred them at cost.
And
She
Ingrid, I did check.
somebody told us that in the beginning when we were talking about this, that it was very expensive.
Right, right, to have an actual
They said
shredder.
the fuel cost to drive a truck out all the way out here
Right.
is insane.
And then the other question from the resident was if we could offer cost-free disposal of tires and electronics
Yeah, that's a.
during,
for
one
during
time.
Earth, just during Earth time, you know what I mean? Just
That
that
day,
day,
that's
yeah, to
Saturday
clean
or
up, yeah,
whatever,
just
one
that
Saturday
one
closes.
recycling day. if
But
we
there's
could.
gonna be people that take advantage of that big time. I mean, why wouldn't I bring 20 of my tires over and charge them?
And it's very
the
expensive for
$3 to
us.
$7 or whatever we charge, depending on the size.
I checked with ProTech Electronics Company about seeing about them coming out, like to set up at the library. And it was, they didn't really want to do it, and then when they gave me the prices, it was just, I mean, they had one last week, and I don't remember where it was, but there was one last weekend, maybe Wineskill.
That's a
county-
That's the county office.
Okay, yeah. But that same company I had contacted before that came out to see about doing electronics.
Yeah. what about,
If I may, Madam
Yeah,
Supervisor, the
yes.
county's going to do about 4 more of those throughout that I think Pierce would be great to coordinate and help with.
I think we're on the, that's a contraction thing, right? We've been working on that. We had to survive.
This is a different, this
Okay.
was electronics.
Okay, and then that's hazardous materials,
And
the
then
other
this
one?
other one's
No,
hazardous.
well, there's, okay, go ahead. Yes.
So there's hazardous materials, which would be a few times a year that we're already prepped for. We're just waiting to get all the dates and see
Okay.
what we're gonna do. And
Right.
then there's the electronics
Which is.
events, which is
Which
what
they
Bill's
just had
talking
one,
about,
right?
which they just had one, which they'll have more this year.
Okay, and that's free?
And that's free
Okay.
to anyone in the county.
But it doesn't take TVs.
No,
No.
well, it doesn't, yeah, it doesn't take the old style TVs. But they don't take CRT stuff at all, but I was amazed at what they did take. But, you know, that's something to look into, and it's gonna be spread around the county at
Do
different
you
sites.
have the dates now? Do we have those dates?
We do, I just don't have them up right on me.
Yeah, I don't
So when
either.
you get them, you'll
Yeah,
keep us
okay,
posted?
yeah.
We do accept TVs here, they just have to pay for it to get taken away.
Mhm. Okay. Okay, anyone else have any communications received? No? Okay. All right, we're on to new business, which is the Grafton Rescue Squad presentation.
We'll see how well. Thank you. This is the PowerPoint we'll be presenting tonight.
Thank you.
You can go before. Right, you guys were here before, weren't you?
Of course.
Yes, right, I remember, okay.
We had a very lovely conversation.
Yes.
Would it be all right if we dim the lights on them?
Sure.
I don't know how to do that.
Dim the lights, I know, I know.
Behind you. Thank you.
We'll be in a minute.
Get Grafton signed that.
Sorry, we didn't find a primarily free wall to project on, but my name is Peter Brody. I am with Event Management Training Solutions of New York, and this is my business partner, Adam Fink. And we'd like to talk to you a little bit about what we've been working with on developing partnerships for Grafton Rescue Squad. So the first one, making sure that we continue the partnership between the town and with the Rescue Squad itself. And then the second one with Grafton Rescue Squad and our company. Throughout the presentation, you will see that we're referred to as EMTSNY. Because I don't particularly like answering the phone with a long answer line, but it's much shorter and easier to brand. So throughout this, we're going to talk a little bit about where we are and who the participants are. So Grafton Rescue Squad's leadership team we've been meeting with for several months now, including those individuals who we're sure that you're all quite familiar with. And then from our company, EMTSNY, it's myself, Adam Fink, and Aiden Enders. Aiden is our operations director. And what we want to do first is tell you a little bit about us, who we are. There are 3 of us. There is, as I already said, my name is Peter Brody. I'm an advanced EMT and I have 26 years experience in EMS. I've been recognized by Schenectady County twice, once in the 1990s as an educator of excellence, and once in 2015 for the leadership that I was showed after our rescue squad building was hit by a tornado. And how the only call we missed as part of that was the call that let us know our building had been hit by the tornado. It was the only one we really missed. And then we have Adam Fink. Adam has been in EMS and fire for 15 years. At the age of 18, Adam was president of his fire company. He's currently serving as the second assistant chief at a different fire company, living in a different municipality. And he served for 4 years as a training officer at the ambulance corps that we both belong to. And as part of that, he was also recognized for advancing the training program at the ambulance corps. Aiden is a basic EMT. He has 7 years experience in fire and EMS. He loves both aspects of it. He currently works with commercial EMS, and he's also been recognized, in his county as well as in the Hudson Mohawk region as a Youth Provider of the Year. And in the middle of COVID, that says something. So Aiden was originally one of the youngest EMTs in the state. He was so energetic, he took the class at 16, finished when he was 17, and tested to become one of the first 17-year-old EMTs in New York State. What is our mission? What does our company do? We seek to develop high-quality training opportunities for the training programs that we put on. We don't want to come in and just do a PowerPoint blitz for someone. We want to make sure that the experience of attending the training is worthwhile for the student, the learner, as well as those leading it. We develop, design, test, and evaluate emergency medical systems. So we have taken both the rescue squad or the ambulance corps that we both belong to, as well as looked at others around us and partnered with those organizations to help make our service better. So we want to take the experience that we've had and doing that to help improve what Grafton is going to be doing. We integrate leadership skills and traits. We take a look globally at how leadership in a particular organization is acting and how we act and how we can provide them with support, and taking a look at different ways of resolving issues, to help avoid losing volunteers at the same time. And then the partners, that would be Adam and I, bring the quality expected in their own lives into the work provided for others. We both have high expectations of ourselves, we have high expectation of others, and we only bring staff in to work with us who believe the same way that we do. And what do we do? Well, as in EMS and most things, let me move the computer a little bit here. There. As with most things in healthcare, everything turns into a 3-letter acronym of some form. So we do EMS event management. As partners, we've worked with a different company. We worked with a musical, with a music festival. It was a 3-day music festival with between 12 to 15,000 patrons. So we provided 24-hour coverage during that. We do EMS management, consulting, and staffing. We're just venturing into the staffing part, but we've been working with other EMS agencies in the region to provide support. We do training events and conference planning. Schenectady County has annually hosted what's known as a MARE, M-A-R-E, which is a major accident response exercise. So it brings a variety of large numbers of fire departments and ambulances to practice what to do in the case of a significant emergency. They usually partner with the 109th Air Wing at the Air Guard base in in Glendale. So we've worked with them to plan that and bring new aspects to it to improve the experience, not only for those who are practicing, but also for those who participate. We are CPR and AED, first aid, and stop the bleed training. In a town looking at Grafton, if someone has a significant arterial bleed, if that bleed is not interrupted or stopped, that person can very well die. And we're able to teach people how to stop most bleeds. MCI, which is multiple or mass casualty incident. TRACE, which is civilian response to an active shooter event. And evac training. We're both trainers in parts of all 3 of those. We also sell medical supplies. Whether it's through specialty suppliers, we get some work there. Let's talk about 2021 for Grafton Rescue Squad. And approximately 16 total responders. And as part of that, those individuals, the top 5 responders are listed there. But what I want you to notice as part of this is that those top 5 people answered a very large percentage of the calls for those that came into Grafton. That small of a number to serve this area 24 hours a day, 7 days a week, 365 a year, starts to become overwhelming, and we want to help them avoid burnout. So we want to be able to provide the support and develop the partnership with the town of Grafton to allow that to have some support so they're not going on as many calls as they currently do. So in 2021, the rescue squad has elected a new leadership team. We already revealed their names. mention their names. They initiated an internal assessment. When there's a significant change or a transition in a not-for-profit or a government body or a business of some form, looking at how things operate internally, taking that step back and saying, what are we doing right? What are we doing well? How can we improve? Looking at like a SWOT assessment, where do we need to improve? And are we consistent or compliant with what regulations require us to be? Whether it's a New York State Article 30, Part 800, or regulations that come out through Hudson Mohawk Provincetown. And they also want to start working on growing the organization. How can they get more excitement around Grafton? So you're going to see the word Grafton growth in here. So we want to focus what we're doing on the town of Grafton so we can provide the best service possible. And when I say we, I refer to the rescue squad, and we want to help them get there. So in 2022, they partnered with us. We started consulting with them not that long ago. And the first step we did is we wanted to review their billing plan. From a billing perspective, we want to make sure they're maximizing the return, to make sure there's the least negative impact on their patients. So that we wanted to look and say, what reports do you receive from your billing company? How can you tell how someone's account is progressing through it? And in the billing world, there's a term called DRO, stands for Days Receivable Outstanding. Hospitals, do most things electronically. EMS doesn't do everything electronically, but they try to do as much as possible electronically, because the sooner that information gets to the insurance company or the payer or the government, it's the will allow for that claim to be processed faster. And what steps are we taking to ensure that that's happening efficiently for Grafton? So we started looking at that already. We posed some questions. They're going to Grafton Rescue Squad is going to pose those questions to the billing company, and then we're going to be able to take steps from there. So we talked about the values. The values of the organization, and how do they want to manage this? And the approach was we want it to be as pain-free as possible for our residents and our patients. Coming up, we're going to be working with the Rescue Squad on assessing their best practice guidelines as well as their bylaws. The supervisor mentioned earlier in the meeting, I spend all my day on conference calls, so it's always all about the call. Assessing best practice guidelines and bylaws. Are they current? Are they consistent with what the standard of care is? What the latest policies are that come out from the state? Are they consistent with Article 30 and Part 800? Taking a step back and getting feedback from someone else that goes back to the source of those documents. And then we're going to advise them on updates. Is their station complying with what they need to be, with what it needs to be for members to stay there and to maintain compliance with Department of Health requirements, PESH, OSHA, and NHTSA compliance. So we want to make sure everything folds in together. And one that I didn't include in there is CMS. The Center for Medicaid and Medicare Services, Medicare and Medicaid Services. Is our billing practice consistent with the federal government's requirements? The last person we want to irritate is either the IRS or Medicare.
Have you done that part of the consulting as part of the work you've done with the squad in 2022?
No, this is all, we're doing one project at a time.
Okay, so you haven't gone this far to review?
No, right now we're on the billing plan, but we have outlined what the next steps we're going to be looking at.
Okay.
We have the best practice guidelines and the bylaws in our hands, so we are starting to review them while one person is working on the billing. But the billing, we want to make sure that's done more efficiently, done quicker, only because of what their current contract is, and we want to make sure that they get the best benefit, so they can actually outline and figure out exactly how much they either need from the town or and then how much we need to fundraise and stuff like that to actually come up with a decent budget to actually be able to handle everything.
But as far as PESH and OSHA and
That's coming
Department of
We're
Health,
currently-
have you looked at any of that? I mean, are we current now, or was this something?
We're currently evaluating as we go every time we meet, we look around, making sure we're looking at things here and there.
Certificates are in place and they're up to date as they should be now?
To the best of our knowledge, we haven't seen anything that jumps out at us, but we want to make sure we do a comprehensive review to make sure that we can say that with greater confidence.
We are aware I believe there are upgrades coming over to that side
Okay.
with the bathroom. And
Yes.
And we apologize if we set off the alarm during one of our meetings. All right, and then staffing services, if they're approved by the town of Grafton. What we came up with was 2 plans. We looked at the size of the volunteer base that they have, that the rescue squad has. And then we proposed doing 5 or 6 12-hour EMT shifts per week. What we're proposing would be that EMT SNY, our company, this is our colleague Gaten.
Hello, sorry,
Hi.
I apologize. Hey, nice to meet you.
Hi.
Hey, nice to meet you.
Hi.
Nice to meet you.
Yeah.
How are you?
Hudson Mohawk Youth Provider of the Year. 5 or 6 12-hour EMT shifts per week. It would just be one provider, and the rescue squad would provide the driver. So we thought that that was, in our discussions, we thought that that was the best way. Since the town owns the ambulance, it'd be that, and having someone employed by us and contracted here avoid some of that. But then the staff from here, the volunteers from here actually know their way around the town. I can find Grafton Town Hall. I do very well at finding Grafton Town Hall. I can find Grafton State Park. Beyond that, I need GPS and to know which roads are seasonal. Google Maps doesn't do all that well with the seasonal roads. So that was our suggestion. EMT on shift isn't just going to hang out here and hope they get a call, but they're going to check the ambulance supplies and equipment to make sure they're compliant with New York State and regional standards. Our EMTs are already trained to do that. They know what they're looking for, and we're going to make sure they have the right form set up to be able to make it easier for them to be able to do their job. We're going to help maintain an adequate inventory of supplies and equipment. We've visited, other agencies. Adam and I, when we travel, like to go visit agencies. Who will have like an overabundance of one supply. I'm like, how often are you using this? Oh, we don't. Well, that's why the stuff in the back is yellow. That's money wasted. We don't believe in wasting money. So we want to make sure that, we find that balance of how to maintain the supplies, and then instead making sure we have a relationship with the supplies and equipment vendors so that, they can maintain a decent supply without being oversupplied. Respond as the EMT to any dispatches, and then additional EMT-related tasks whenever necessary. So, if someone stops by the building, runs their blood pressure check, because, they just don't feel right, can you check me out for a second? You have a person here in the building waiting for you. 5 or 6 12-hour days per week. So, what is a rescue squad's request from the town of Grafton? And for those in the audience, I apologize. I had no idea it would be plastered across a wooden sign that says Grafton, 1807, but now I know when the town was formed. Increase the investment in Grafton Rescue Squad for the months of July through December. We understand that establishing, any type of increase in funding, takes a little bit and some work related to that. So if it's to be 5 hours or 5 shifts per week, 12 hours each, that'd be 60 hours a week, and the dollar amount for that would be $55,000. And EMTSNY would cover all of their employment taxes, workers' comp on our employees, so there would not be an additional policy that has to be taken out for them. And we would take care of everything related to that. If we say we're going to have somebody here at 6 a.m. picking a start time, I'm not a morning person, so that for me would be a challenge, but then we will have someone here at 6 a.m. Or to look at 72 hours a week and at 6 12-hour shifts per week, that would be $63,000. And I'd like to maintain the funding approximately of $18,000 per year for operational expenses. So the question is, what do you get back from that? What are you going to get back from that? What will Grafton Rescue Squad do? They're going to start building the squad for long-term continued service to the town of Grafton. They want to make sure they're building their base, they're strengthening the organization, making sure they're compliant with all the regulations, and that they're looking forward to the future. And then they can focus on other things, instead of always sending 2 people out on every call, they only need to send 1, someone who's qualified to drive the ambulance. Increase recruitment for additional volunteers. Once we look at how the station is organized, and we look at things, you want to make Grafton a destination for people who want to come out here and volunteer. And you do that by including training opportunities for them, you provide them with a decent place to stay, a modest call volume that's not going to be overwhelming for them, You know, there might be a 12-hour shift at night where they might be able to sleep through the night, you know. And then there will be retaining consulting services with us to complete the internal assessment and the items that we've been working on with them. You know, I have found that the rescue squad has been very open to discussion on how to look at everything they're managing internally. And, you know, our discussions have been fairly lengthy, but we're looking at the global picture. You know, and how can we make sure the organization is doing what it needs to do? And we don't just bring in our own thoughts on it. You know, if they need, you know, something like an EMS attorney, or if they need an accountant, or a tax accountant, or if they need a financial advisor, you know, we'll work with them to find a person who's fitting for an EMS agency. You know, your attorney for your town will tell you there's different types of law. You know, they're not going to go out and we want to find them the right attorney, the right accountant who understands the type of organization and what the requirements are that go along with it. We have those connections from our years of doing this and doing this with our own organizations and preparing them for the future. So, what are the benefits of the partnership? The Rescue Squad will remain Grafton-driven and Grafton-focused. So it's focusing on what their primary mission is, to serve the town of Grafton and respond to the emergency medical needs of the town. Going to consistently provide the same quality service with more responders. They will have more assets to be able to do it, so if someone wants to take a week off, not everybody involved is going to be rearranging their lives to be able to do it. And then improving emergency health care in the town of Grafton, they'll have a faster response. You're only going to have one person here. So whether it's Jeremy, Andrea, or Sharon, or Tom coming through to respond, they're always going to have somebody here. So as soon as they get here, that garage door is open and they're on their way out the door. So you're not waiting for two people, you know, who may be stuck behind a slow-moving car. I live out in the country, you know, I get stopped all the time waiting for Bambi to get out of the road. So, you know, you get someone here who can drive the ambulance, you're out the door faster. And you're going to have staff in the station if residents or travelers walk up. See the signs out front that says there's an ambulance station. Now you have someone there. You know what? I stopped by the station. I wasn't feeling quite right. I left my sugar kit at home. You know, I stopped in. They tested my sugar. You know, no, your number's a little low. These are things you want to do. Yeah, and to help them get beyond that initial minor incident in their life, and perhaps help them avoid a trip to the emergency room, but to provide them with their own ability to assess their own situation. So, the town of Grafton will still have a very strong direct connection to the only EMS service focused on the town of Grafton. So, the 5 of you who already have a strong relationship with the Rescue Squad will now have an even stronger one, because you know that both organizations are partnering to invest in the future of the service here. You know, if you're waiting for another ambulance to be able to come out here to a small community and to put somebody out here full time, and put an ambulance out here full time, you're looking at numbers much, much larger than the ones I put in the presentation. Much, much larger for a lower call volume. They're going, any ambulance company wanting to provide you with that service and put somebody out here is going to need to make sure they're covering their payroll. And the call volume just won't do it with the billing. You know, it's that, you know, they're just high enough to be busy, but not busy enough to be financially sustainable for that. And you'll continue to have a strong collaborative partnership with a forward-thinking local service. These are people who say, you know what we have is not sustainable. What we have is not working. What can we do to make this so it's sustainable so we can keep everything focused on Grafton? You know, and that's the discussions we've had with them all along. So, questions? Sorry, I talked very fast.
Yeah.
That's why it was much better you had the PowerPoints ahead of time.
Could you talk a little bit about recruitment? Recruitment's an issue, right? Should there be an issue?
Recruitment is an issue. I think what you need to do, you know, as I mentioned earlier, you really need to make Grafton a destination organization to volunteer at. And by that I mean, there are many of the larger towns. You look at a place like Colony, Rotterdam, Guilderland, they don't really have transport volunteer opportunities. And an EMT goes to school to learn about patient care. They want to do patient care. The average patient contact time for a first response agency, so say Grafton Fire first responded, and they turn the patient over to Grafton Rescue, their average patient contact time is anywhere from 5 to 7 minutes. That doesn't really allow you to have the time to do a quality assessment. So what we're looking, one of the approaches is to do, to arrange like a hybrid arrangement, which is what the proposal is, or to make your organization a destination to volunteer. In the 1990s, I volunteered with a hybrid organization in Amsterdam, New York. And for me, we would do 3 or 4 calls in a 12-hour shift. The whole sleeping through the night thing over there was not an option. But we got up and I had an amazing learning opportunity. Now you have people who want the opportunity to sleep, but still go out and do things. That ride from the patient, from the incident, the scene, to the hospital is where a majority of the patient care happens. And the ability to do that allows that person to learn and grow as a provider. It's not the 10-minute transport, that the city and the urban settings have. You want that time to be able to connect with your patient, as well as learn about your patient's illness and to be able to help that patient provide greater satisfaction than simply turning the patient over. The average first response call time is 20 minutes, and at 3 in the morning, it's novel to go back to bed that quickly. But the learning opportunity as part of that is where a lot of that recruitment will develop from. It'll take a little time, but we have a little building to do too. That's a great question, though.
So are you proposing 2 options? Is that what I'm reading here? One is
5 12-hour shifts a week, and one is 6 12-hour shifts a week.
Okay.
Just giving you the idea on the price range. One of the things I've learned in looking at proposals and contracts and things is, if you don't have the numbers and things, if I come to you with a 5-day-a-week total, and you came back and said, well, what if we wanted you for 6? Because we really, we think just one 24-hour period they can manage it. That'll work. And this schedule will work for the volunteers that are currently here. So we've learned to put in options to show you what the difference would be.
And obviously, you probably pick the busiest days to come in. And
We would collaboratively, they would, the leadership at Grafton Rescue would tell us the days they want us to do.
Oh,
And if they were doing, having an annual banquet, say, right now, they can't really go anywhere to have it except the pizza shop down the street.
Right.
Because, they still want to be able to respond to their town. So, but now, if they tell us 3 months in advance, hey, we're going to have our banquet this Saturday in whatever month, can you provide us with 2 EMTs for that night, so we can just go out, relax, and have a good time, and we'll be ready for 6 a.m.?
Right.
Sure. We're happy to make the arrangements, provided we have an appropriate place for our staff to be.
And to add on to yours thought about the busiest days. We can look at a trend for busiest days for the last couple of years, but we aren't in retail, we're in EMS. It changes.
Yeah.
COVID proved that. COVID showed that. It changes.
Do you have a pool of EMTs that work for you right now that you're going to assign here? To
Yes.
come out? That's
Yeah.
how many EMTs do you have that you can call on to staff?
If the option was available, if the option was to fully staff or to mostly staff, we could. We're actively hiring as of right now as well, because we have other ventures that we have as well.
Would the option exist to hire someone from Grafton who's already on the squad as your EMT? And have a paid member, have someone who's already here working be the paid member?
We would discourage that because it might interfere with your insurance. The question is, are they responding as an employee, or are they responding as this? Are they responding as a volunteer? And if there's a gray line in between there, we want the lines to be very clear. These arrangements that we've worked with in 2 other squads, ours, and then I assist a colleague of mine elsewhere, is that you either are a volunteer or you're employed. We don't mess the two, so we don't mess up with the insurance and cause any issues with labor law.
And the insurances you cover are strictly employment insurances, not liability or workers' comp, or you do cover workers' comp?
We cover workers' comp.
Okay.
And liability for our employees.
Liability
Right.
for your employee, okay.
We automatically have those policies anyway.
Okay.
We'd be, it would not be wise to be in this field and not have that.
If you were to be engaged, would you expect any insurance coverages from the town for EMT services, your company?
For our company?
Yeah.
No.
No, so no insurance would be?
No.
And if this were to come into place from July through December and then January through December next year, we're looking at 110,000 plus 18,000, so 128,000 for the squad next year, and then potentially 126 plus 18, which is 144,000 a year, or increased cost probably because of inflation and.
There would be a potential for the increase, in the cost, but yes, it would be an investment of that to keep everything that we're doing draft and focused.
So when you say craft and focus, there's no involvement for Petersburg or Berlin? You guys aren't, it's not like it was, what we were proposed before was a tri-town, so it was craft and ambulance in Berlin and Petersburg and sitting in Berlin for a couple days a week. Is there anything with that here?
Our staff would be right there.
Would you respond to calls in other communities though, mutual aid calls?
We would have to.
We would comply with the mutual aid request.
County request.
Mutual, I can touch on it a little bit. I'm the operations director, if you guys saw that earlier on. Mutual aid goes both ways. You can't mutual aid to get it when you need it, you also have to give it. So the county has the proper mutual aid plans through the 911 center in Troy. So some days we may go over to Petersburg when they can't fill a crew, but the next day Petersburg could come over here. So it's a two-way street, and that's system-wide. That's everywhere. That's par for the course everywhere. Every agency that has hybrid staffing does go mutual aid, and they do receive mutual aid as well. So it's a two-way street, and it's going to take some ironing out. Maybe we need to revise the mutual aid plans for the daytime. A lot of places have different mutual aid plans based on the time of day and whatnot. So as always, data drives decisions. So we'll have to look at that in our first 6 months and see where it goes. Everything is it's going to be very fluid the first 6 months. We got to see what works, and by the end of the 6 months, hopefully we do have it figured out. We'll figure out what works. We'll coordinate with the other agencies, coordinate with the county, coordinate with dispatch center, and that's what we'll help the squad with as well.
That's where the hybrid comes in. You guys are working with Mark.
Yes.
Yes, we're already working with the rescue squad.
Yeah.
We're consulting and stuff, and we're going
Right now. We're not staffing at this time.
Are you paid now for what you've been doing so far? Paid by the rescue squad?
We have a contract with them, yes.
So you have a which involves financial remuneration?
Yes.
It says you're working on their billing. Is there a potential to where these costs could go down?
Where the revenue recovered may increase to assist the rescue squad in having a broader financial base to be able to cover more expenses. Did that answer what you were looking for?
No, that was a roundabout thing.
I watch a lot of political discussions, sorry. Now, is there a chance that the request from the town could go down? For the operational side?
So say
Yes.
next year, are we locked into this price for next year? Or
No.
is there a possibility that you get the billing, work on billing and possibly?
If they're billing, and I don't know how much they're collecting from billing right now, but I'll just pick a nice flat number for a discussion point. Remember, this is all hypothetical. So say they're collecting $50,000 a year in billing now, and we improve their relationship with a billing vendor, and that $50,000 increases to $90,000. Would that help to modify the request that's coming forward? Yes. But, we have to assess what they're receiving now, and then look at, what, the impact of that. But understanding, you remember earlier I mentioned the term DRO, days receivable outstanding. So if they make a change in the billing vendor or they make a change in the billing process, it's going to take a good 3 to 4 months for that change to have a financial impact. So you may not see that by the time January rolls around, or by the time, but you might see the trend starting that way. But we're gonna provide the rescue squad with data that shows, how the changes we're making are going to be beneficial for them. Did that get better?
Yeah.
Okay. Lots to think about, right?
Maybe at our next workshop, we can talk about this a little bit. We have to definitely see a contract before thinking about anything.
And what about like a public referendum, Phil?
You're technically normally not allowed to do a referendum on this kind of issue because it's contractual. From what I heard, these guys would be coming in as independent contractors.
That's correct. We'd be coming in as independent contractors of the rescue squad.
I mean, I'll research it more, but normally you can't put onto the public your decision-making obligation.
Okay.
But I can look into it.
Could we at least do a public hearing?
You could do a public
Yeah.
forum,
There you go.
not a public hearing.
Okay. So we wanted the public to feed in on this
We
before
definitely want the
close it.
public.
Public hearing is normally before a local law is adopted,
Yeah.
but a public forum is something like this. Before you take a contractual step, you want input from the public, you could have a public forum.
Okay.
And we'd be happy to engage in that if the rescue
Sure.
squad allows us to.
I think that's very important.
They said yes.
Okay.
I can see Jeremy's thumbs up from the front of the room.
Hey, Jeremy, how do you feel about this?
I think we need to do something. And I think what we've come up with, this is the best path forward.
All right.
Table this till the workshop after that.
Yeah, any other questions?
We can have a preliminary draft contract written for you guys and have it for you guys tomorrow morning.
Do you do this with other municipalities presently?
Not this particular service, but we have implemented this through our own agency as well. So we went through the challenges that accompany such a transition. And we've also worked in hybrid situations as well. So we're familiar with the challenges that come along with it. But
Are you providing services to any other rescue squad? Like, do you know what I mean? Like,
no, we're not doing hybrid staffing elsewhere.
Elsewhere, no.
That we provide. We work with a hybrid partner at my home agency, at our home agency.
Okay.
We are in your shoes at our home agency. We receive hybrid staffing from another agency.
What's your home agency, Aiden?
Dwaynesburg.
Dwaynesburg, okay, that's right, Jeff. Okay.
So we travel out that way.
we see both sides of it. We see what works, and more importantly, honestly, we see what hasn't worked. And we'll absolutely bring what works here, and we're going to leave what doesn't work in Dwaynesburg. We'll leave that far away.
Learning from other opportunities.
Right.
We do staff other ventures. We've done running events, we've done summer camps for healthcare directors, overnight camps, so racing events and stuff like that as well.
And a very diverse clientele between orchestra, band, and go-kart racing. And honestly, each one of them has their positives for very different reasons.
Okay.
Thank
Thank
you.
you.
Thank you.
Thank
you, guys.
Thank you.
We're going to take all of the rest of it.
Yeah, but it's not the hours, aren't there either?
What's the hours for the lamp?
When are they gonna do this?
Oh, I don't, I'd have to pull
I
it
don't
all out.
have
Yeah.
that people with me.
Right, okay. Okay, where are any other new business? We're under new business.
No. I'll look at
Okay, any other new business?
Oh, where are we? I lost my papers.
Old business?
No.
Old business going once? Okay, all right, we're comfortable moving on to public comment? Yes, okay, public comment, the privilege of the floor. Reminder that public comment is limited to 5 minutes per person. Be mindful the public comment portion of the meeting is a privilege. All comments and statements shall be directed to the town board. Please refrain from any personal attacks, name calling, or derogatory public comments toward individuals. Okay, Steve, are you ready with our? All right, Steve is our official timekeeper for the 5 minutes. This is the part where she looks up. What do we got? That sounds great. Good. Oh, bye.
All right, I just have a tiny little thing.
Okay.
On the back where it says the next meeting / workshop, I always look on the back to see the next month's meeting. So if we could have that date on there as well as the next workshop. It's just a tiny little thing. I know it's the second Monday of the month, and I always look back in my calendar, but it's like I just flip it over. I'm like,
So you're requesting just an extra line to say in the next
Yeah.
town board meeting?
Yeah.
Of the
Okay.
next town board
We
meeting.
can certainly accommodate that. Okay.
big request, I know.
Yes. Meeting as well, okay. Okay. More from the floor tonight? Yes, Mr. Buckley.
Thank you. David Buckley. First thing I just wanted to bring up real quick was public safety issue on Blue Factory Road. Last year, or 2 years ago, social media sites, there's a potential rock slide between Bahuniak Road and,
Bahania.
yes, between Bahuniak Road, and Palliser. But nevertheless, in all seriousness, this is, the residents have taken it upon themselves to put up pylons. And I know that last year folks had called the county. This is actually needs to be addressed, and I know it's a county road, and I didn't want to bring it up to Jared, but somebody needs to call. Somebody needs to call. Somebody with some pull needs to call to have this taken care of. It's the old road on the side. It's about 30 feet up, and there's like 10 huge boulders that
Tell
are
me the intersection again, Bahania.
between Bahuniak Road, and Palliser, Norm Palliser's place. If you're headed up Blue Factory, it's on the left. You can't miss it. There's pylons there now. I know Randy Rump brought it up on social media for the Grafton site. I know that other people have called, but it really is time to address this issue.
Jared Waltbank, Cropsyville.
I'll be having lunch with Dave
There you go.
Wednesday at county meeting. He's
You
the
can't
head of
miss it because there's a pylon right there.
I'll go up tomorrow and look at it so that I know right what to describe to him.
The neighbors would appreciate it, and I know everybody would appreciate it, so some sort of remedy would be great. It talks about here that you have the final report. I continue to be marveled at the inability of the town to share this prior to public comment. So
You might have missed that we have to adopt it before we make it public.
No, I heard that, but
Okay.
it would just be great if we knew what that was, if you could put that resolution prior to the public comment, and then we could understand what's taking place. I don't know why we continue to do that. Allow public comment, and then yet you put your resolutions and all your actions after the end of that.
That way you can comment about the resolutions we're gonna pass. If we put the
Well,
resolutions
you didn't
ahead
provide
of
the
public-
resolution, Mr. Lewandowski, so how can we possibly comment on something that the resolution doesn't include? Right? I mean, that's pretty obvious.
Yeah, I think you should have a copy of that.
Right, so, I
agree
mean,
with you.
I've talked about this issue several times, and I don't know why we don't do this. It's actually, it just creates the idea that, that you're trying to mislead the public and not share with us what you're gonna vote on momentarily. So I think that's a misstep. Secondly, I listened to the ambulance budget. I know that we spend $18,000 a year to give the ambulance, and I appreciate the gentleman outlining this for us. But a lot of this is regurgitated from last year. And, we had these questions, and a lot of this was brought up. For instance, I brought up the question of whether you have any, have you been, are you guys, I guess the best way to put this, are you doing any municipal stuff now? Is there any municipality that you currently work for? Have you been accredited by the state? I just don't know how things have changed in a year when a lot of people went into we had a forum, like he said, and people wanted this, but we heard from the whole board that it just wasn't possible financially. So I don't know how all of a sudden in a year that's changed. And I would really love some light on that. I know the leadership change, seems that people have had an epiphany in that, we need to do this. Well, I've always been in favor of an ambulance, and I support the people who do it. I just don't know how financially we're going to do it when we only give them $18,000. $18,000, $10,000 of that goes toward insurance. We're left with $8,000. We haven't even put a Band-Aid inside the ambulance yet. How are we going to support this? I mean, if we're spending money for forensic audits at $18,000, we literally just spent the whole year's budget line for the ambulance on an audit that we don't even know how it came out. Does anyone not find that strange? Am I the only one? We spent $18,000 on a forensic budget, which is the same amount of money that we spend for our ambulance. It's just, that too is a marvel. So I question that, and I question all your judgment on that. We need to start giving the people something. We need to do that. There are seniors who need this service. And if we're doing 11 calls, I don't understand how we're going to pay for $55,000 on a hybrid and $63,000 for 72 other hours. I just don't know where you're going to find the money. And if we're going to waste money on forensic audits to make someone look bad, I mean, I told you years ago what the problem was with the audit. I bet you I'm right. It comes back to the deputy town supervisor who screwed up 2 years ago. And if that's the case, I didn't charge you a dime to tell you that. So at the end of the day, at the end of the day,
5 minutes.
we're going to need to get this right, and we're going to need to start doing the people's work. Please do that.
Thank you. Thank you for your comments. All right, anyone else from the floor tonight? Yes, Anna Calabra.
I was just kind of wondering how this plan is different from last year's plan, and how the cost is different, because we were covering 3 towns last time, and this time it's kind of really only covering this one, and it seems to be about the same amount of money. So, I don't know, it seems a little weird. And then does the ambulance, and I'm not expecting an answer, so does the ambulance pay for EMT, SNY, or is the town paying for it? I don't really know. And I don't know why we never heard about them contracting with the ambulance before, unless the ambulance really is a private entity and we don't have any say in it. That's about it. Thank you.
Thank you.
We are a private entity, so we don't have a say in it. I know last year what was proposed was 3 towns. It was about $60,000 per town. So 60,000 times 3 is what the real cost was.
But not to us.
For a year.
For a year. So
This is 60,000.
So it would have been 60,000 for us, and I know at least 2 or 3 days our ambulance was going to be in another town, not in Grafton.
Anyone else tonight from the floor? Okay, thank you. All right, moving on to motions and resolutions. We have resolution number 22, which is a budget transfer. Whereas the town of Grafton is desirous of making budget transfers and budget lines as listed below, and such transfers having been approved by the town bookkeeper. Now therefore be it resolved that the following budget transfers be authorized to pay for town expenses and services. From account number A1320.4, independent auditing bookkeeper, we're moving 500. From DA 1710.1, administrative personal services, $1,716 for a total of $2,216. We're moving that money to account number 1320.1, independent auditing, for the bookkeeper, $500, and then DA 1989.1, other general government support. We're moving the $2,216 there. The account numbers, we're increasing our A 4089 federal aid by $12,698.64. A 1620.4 buildings contractual, $7,920.14. And A 4540.4 ambulance contractual for $4,778.50. I would like to make a motion to adopt Resolution 22 of 2022. May I have a second?
I'll second it.
Seconded by Councilman Beaudry.
Councilman Bowdre,
Yes.
Councilman DeShane,
Yes.
Councilman Hoyt,
Yes.
Councilman Lewandowski,
Yes.
Supervisor Leonard.
Yes. Okay, adopted unanimously. Resolution number 23 of 2022, affirming Town of Grafton sponsorship for the Grafton Town Festival. Whereas an annual festival is held in July of every year, known as Grafton's Town Festival, and whereas this popular and well-attended festival includes Grafton's Our Lady of the Snow's mission sponsorship of Sister Kennan's Giant Raffle, a chicken barbecue, and numerous vendors and summer activities. And whereas all Grafton's organizations are welcomed and encouraged to participate in the festival. And whereas all Grafton citizens are invited and encouraged to attend and participate, along with citizens of other communities. And whereas the town of Grafton has been advised that the 2022 festival, I see that too, will be held on Saturday, July 16th, 2022 from 9 a.m. to 4 p.m. on the grounds of Grafton's Town Park on Roxborough Road. And where it is customary that the town of Grafton approves and sponsors the festival and authorizes the use of the town park for this civic activity, now therefore be it resolved that the town of Grafton hereby sponsors the annual Grafton Town Festival to be held on July 16th, 2022. I'd like to make a motion to accept resolution number 23. May I have a second?
I'll second.
Seconded by Councilwoman DeShane.
Councilman Bowdre,
Yes.
Councilman DeShane,
Yes.
Councilman Hoyt,
Yes.
Councilman Lewandowski,
Yes.
Supervisor Leonard.
Yes. Okay, great. Resolution number 24 of 2022. Whereas the Deputy Town Clerk, Amy Durham, has submitted her resignation effective April 30th, 2022, and whereas the town needs to appoint a new Deputy Town Clerk, therefore now be it resolved that the Town Board of the Town of Grafton hereby accepts the appointment made by Victoria Burdick, Town Clerk, of Amanda Mason as the Deputy Town Clerk effective May 1st, 2022. I'd like to make a motion to accept Resolution 24. May I have a second?
I'll second.
Seconded by Councilman Hoyt.
Councilman Bowdre,
Yes.
Councilman DeShane,
Yes.
Councilman Hoyt,
Yes.
Councilman Lewandowski,
Yes.
Supervisor Leonard.
Yes. Okay. And then resolution number 25 of 2022, a resolution accepting audit. Whereas Ferraro, Amodio, and Zarecki, CPAs, have conducted an audit of the town of Grafton for fiscal year 2020. And whereas the town board of the town of Grafton has reviewed such audit, a copy of which is attached hereto, and good cause appearing therefore, now therefore be it resolved that the town board of the town of Grafton hereby accepts the findings contained in such audit and thanks Ferraro, Amodio, and Zarecki CPAs for its service to the town. I'd like to make a motion to adopt resolution number 25. May I have a second?
I'll second it.
Seconded by Councilman Lewandowski.
Councilman Bowdre,
Yes.
Councilman DeShane,
Yes.
Councilman Hoyt,
Yes.
Councilman Lewandowski,
Yes.
Supervisor Leonard.
Yes. All right. I would like to make a motion to pay the bills as audited. Tonight we have vouchers number 161 through 206 for a total of $62,993.78. I'd like to make a motion to pay the bills as audited. May I have a second?
I'll second.
Seconded by Councilwoman DeShane.
Councilman Bowdre,
Yes.
Councilman DeShane,
Yes.
Councilman Hoyt,
Yes.
Councilman Lewandowski,
Yes.
and Supervisor Leonard.
Yes. All right, the next meeting will be our workshop. It'll be held on April 25th, 2022. That's 2 weeks from tonight. And the next town board meeting will be held on May, I have a calendar. May, no, I don't know. Okay, it'll be the second Monday in May, Tamara. Okay. The second Monday.
May 9th.
May 9th, thank you. I shut my cell phone
I
off, so I don't have my
said
calendar.
I wasn't sure.
May 9th, so Monday, May, is that your birthday, Frank?
No.
May 9th? No? Okay. Okay, So the next town board meeting will be Monday, May 9th at 7 PM. Okay, legislative privilege. Anyone have anything they'd like to go over tonight? Not tonight, not tonight. Okay. All right. Yes, I think added into that, don't you think? Yeah. Yeah. Added into our workshop meeting. Yeah. Okay, and we, no one in memory of. Okay. Let's adjourn this evening. I was gonna say something about Ukraine and our troops. Let's adjourn with good thoughts for the rest of the world. So, may I have a second on adjournment?
I'll second.
Thank you. All in favor? Aye. Okay. Thanks, everyone.
Very informative.
Yeah.
Very informative.